Right then, let's get into it. Have you ever really stopped and thought about the incredible, complex wiring that's running inside your head? I mean, your brain is the command center for absolutely everything. But how does it actually tell your eyes to see, or your face to smile, or your tongue to taste? Well, it all comes down to a set of very special, high-speed cables. And this is them, the 12 pairs of cranial nerves. You should think of them like dedicated fiber optic lines. They actually bypass the spinal cord, giving your brain direct, unfiltered control over everything from your sense of smell right down to the movement of your shoulders. They really are the super highways for all the sensory information coming in and all the motor commands going out. It's a truly beautiful and complex system when it's all working. But that, of course, raises a pretty important question. What happens when these vital communication lines get cut, or compressed, or even just inflamed? Well, the effects can be incredibly sudden and, frankly, quite dramatic. So, let's begin with what is arguably one of our most precious senses, our vision. This is the exclusive domain of the optic nerve, which is cranial nerve number 2. One of the most common problems you can get here is something called optic neuritis. This is basically where the optic nerve gets inflamed, and it's often because its protective coating, the myelin sheath, gets damaged. It tends to pop up quite suddenly, usually in younger adults, and it presents as painful vision loss in just one eye. You can imagine that is an incredibly frightening thing to experience. Now, what I find really fascinating about this slide are these authentic, handwritten notes. They give us a proper little glimpse into how a clinician thinks. And look, you can see a key point circled right here. Despite how utterly alarming the symptoms are, there's often a good prognosis. For most people, their vision comes back, which must be just incredibly reassuring to hear. But a much more sinister cause of vision problems is something called papilledema. Now, this isn't actually a problem with the nerve itself. Instead, it's a huge warning sign of a much bigger problem. There's a dangerous rise in pressure inside the skull, and it's physically pushing on the nerve. And unlike optic neuritis, this almost always affects both eyes. And this just illustrates the difference so brilliantly. This is what a clinician sees when they look into the back of your eye. On the left, you've got a perfectly healthy optic disc. See the nice, sharp edges? But then, on the right, in papilledema, that intense pressure causes the disc to swell up, completely blurring the margins. It's a massive visual red flag. So, as you can imagine, finding papilledema triggers an immediate, urgent investigation. Doctors need to find out why that pressure is so high, which is why they turn to tools like an MRI scan. They're hunting for the underlying cause, which, and you have to be prepared for this, could be something very serious, like a brain tumor that needs dealing with right away. Right. Let's move on from sight itself to how we actually move our eyes. It's not just one nerve doing all the work. It's more like a finely tuned orchestra of 3 separate nerves, the oculomotor, the trochlear, and the abducens, and they all have to work together in perfect harmony. This slide gives us a fantastic overview of what's going on. Each one of your eyes is controlled by this little team of 6 highly specialized muscles, all pulling in different directions. And our 3 cranial nerves, they're the conductors for this intricate muscular ballet. Okay, so first up is cranial nerve number 3, the oculomotor. This one is the real powerhouse of the group, no question. It's in charge of 4 of the 6 eye muscles. It's the one that lifts your eyelid up, and it even controls the size of your pupil. It really is doing most of the heavy lifting. So it makes sense that when the oculomotor nerve gets damaged, the signs are completely unmistakable. You get what's called ptosis, which is this droopy eyelid here, and because most of the eye's muscles have been knocked out, the eye gets pulled by the ones that still work into this really classic down and out position. You can see it so clearly in this picture. Let's move on to cranial nerve number 4, the trochlear. Now this one is a pure specialist. It has just one job and one job only, to control a single muscle called the superior oblique. And that muscle is what moves your eye downwards and inwards. Go on, try to look at the tip of your nose. That's the nerve you're using. So when this highly specialized nerve is damaged, it causes some very specific, very odd problems. Patients get vertical double vision, where one image appears on top of another, and it gets much, much worse when they try to look down. So imagine trying to read a book or just walk down the stairs. It becomes incredibly difficult. And all this leads to a really fascinating coping mechanism. And here it is. To try and correct that double vision, patients will instinctively tilt their head away from the side with the damaged nerve. It's a completely subconscious action. Their brain is just trying to realign the images from the two eyes. For a doctor, this is one of those classic telltale signs. And completing our trio of eye movers is cranial nerve number 6, the abducens. Just like the trochlear, it's another specialist with one simple but absolutely vital job. It controls the lateral rectus muscle. That's the one that pulls your eye outwards, away from your nose.
So, as you might guess, if the abducens nerve is damaged, that outward movement is gone. The eye can no longer move outwards, so it drifts inwards towards the nose, and that causes horizontal double vision. And you can see in this picture, the patient is trying their best to look to their left, but their left eye, well, it just can't make the journey.
All right, from the complex dance of eye movements, let's now turn to the nerve that literally brings our face to life. It controls all our expressions, our sense of taste, and even affects how we hear. Let's talk about the facial nerve, cranial nerve number 7. Now, the most common problem with this nerve is something called Bell's palsy. It's a sudden, acute paralysis of one entire side of the face. And here's the vital clue for doctors. It affects the entire side, and that includes the forehead. That specific detail tells them the problem is with the nerve itself after it's left the brain and isn't something more serious like a stroke. The diagnosis is pretty much all based on these clinical features. It comes on really fast, usually over a day or two, and it's sometimes preceded by a bit of an ache just behind the ear. And because the facial nerve also handles taste for the front of your tongue and controls a tiny muscle in your ear, patients might also lose their sense of taste or find normal sounds uncomfortably loud. Interestingly, it's often linked to the reactivation of the same virus that causes cold sores. So as we've seen again and again, just by looking at these very specific functions and, well, dysfunctions, we can learn an incredible amount. The cranial nerves aren't just simple wires. They're a direct window into the health of the entire central nervous system. Let's just quickly run through that diagnostic power again. A young person with sudden vision loss, your first thought is optic neuritis. You see that classic droopy eyelid with the down and out eye? That points straight to an oculomotor nerve problem. Facial weakness that starts after an earache? It's almost certainly Bell's palsy. And the clues just keep on coming. If someone's tongue veers off to one side when they stick it out, that points to an issue with yet another cranial nerve, the hypoglossal. Each nerve tells its own story. And that really brings us to the main takeaway from all of this. This quote just sums it up perfectly. The face and the eyes, they're not just for showing emotion and seeing the world. For a trained observer, for a clinician, they are an open book, a rich source of information about what's really going on deeper inside the brain and brainstem. It's an incredible testament to the brain's intricate design, isn't it? But it does leave us with a final thought to mull over. If these nerves are just the wires carrying the signals, what does it tell us about the sheer complexity of the command center itself when those signals get crossed or weakened or lost entirely? That's something to think about.